1 year ago, the central Chinese city of Wuhan went into what was then an unprecedented lockdown. 11 million people were isolated from the rest of China and the world in a desperate attempt to prevent the spread of a deadly coronavirus. That attempt failed. Cases were quickly identified in Thailand, Japan, and South Korea, and the United States began restricting travelers from China. In Wuhan, authorities built makeshift hospitals to treat thousands suffering from the illness. The world's second-largest economy was at a standstill as authorities fought to contain the outbreak. In February, the virus was officially named COVID-19, and Europe faced its first major outbreak. A surge in cases in Italy spurred a lockdown in Lombardy, while it also arrived in Iran. On the 11th of March, the World Health Organization declared a global pandemic.
We have never been before seen a pandemic sparked by a coronavirus. This is the first pandemic caused by a coronavirus. And we have never before seen a pandemic that can be controlled at the same time.
The number of coronavirus infections around the world now exceeds 100 million, and more than 2 million people have died. The US, Brazil, and India have recorded the highest number of deaths. More than 50 countries are now racing to inoculate their populations. Several vaccines have been approved for use internationally, but poorer countries are struggling to secure doses. Meanwhile, fast-spreading virus mutations are raising concerns over vaccine efficacy, concerns health experts are trying to address.
There's a thing called a cushion effect. So if you have a vaccine like the Moderna and the Pfizer vaccine that can suppress the virus at a dilution, let's say, of 1 to 1,000, and the mutant influences it by bringing it down to maybe 1 to 800 or something like that, you're still well above the line of not being effective.
In China, months of tough measures and closed borders have seen the outbreak largely controlled. But in the north, authorities are now battling resurgent cases. In Beijing, mass testing and tracing measures have been reimposed. They're not alone. Countries previously lauded for low numbers of infections have reintroduced restrictions due to increases in cases. 2021 may be a new year, but the WHO has warned that the global fight to contain COVID-19 is far from over. Katrina, Aljazeera, Beijing.